It doesn't feel like 25 years.
It really doesn't, because I still remember sitting in the basement of the health department with the Healthcare Reform Commission developing Right Care and thinking of what would a health plan to serve the underserved would look like. And here it is 25 years later.
So the health centers formed a neighborhood because we didn't want to deal with national conglomerates like some of our competitors, and we wouldn't have a say on what was happening in healthcare in Rhode Island. So basically it was formed to have that local organization that would help the state and also help the health centers provide care.
Those early years were really a struggle from paycheck to paycheck to get this thing off the ground. Really required a leap of faith amongst the people who had the vision for the plan.
Parents will do anything to keep their kids healthy and safe.
When I started back in 1996, we began servicing families with children only up to the age of 8.
You may be eligible for neighborhood if you are pregnant to have children.
Actually, it was only women and children up to the age of 8. Thereafter, we began to service families, and we began to include children up to the age of 19.
We were initially started as a mom and baby plan, right? Not a whole lot of membership.
Back then it was 5,000, 6,000. We remember waiting for it to reach 10,000. And of course now it's almost 200,000.
That's pretty impressive, serving 1 in 5 Rhode Islanders.
I didn't really know it was a real chance that I was taking. This was this brand new plan that was starting. And at the time, we were worried that we weren't even going to get our utilization review license, which would mean that we couldn't even have a presence in Rhode Island. So it was a big chance that I took, and I'm still here. I'm so happy I took that chance.
I used to work for a community health center back in 1992. And I remember we didn't have neighborhood health plan back then. And I remember that when patients used to come in, they only have Medicaid fee-for-service, which meant that they had to navigate their own healthcare system.
Healthcare system is confusing, and for those that are most vulnerable, it becomes even more confusing. So without neighborhood, we would probably have more uninsured in Rhode Island.
Before neighborhood, health centers were the only places that poor people could go for health care. Now they can go all over the state, with private doctors, clinics, hospitals. Patients have a choice, and that's something that it's what we dreamed of.
The health of the state's population, I think, has improved because of neighborhood's presence. I really believe they've done a great job. In their network, of course, the community health centers serve over 50% of their members. In combination, I think the state's in a much better position from a population health standpoint.
And what's even better is that the high quality care that folks are getting access to is something that compares nationally. There are plans across the country who have watched neighborhood grow, and they are quite envious as to the quality of skill that's brought to bear, the level of care that folks are getting, and the tremendous partnership we have had with the community health centers.
The evidence is there. It's overwhelming that, number one in the country when it comes to providing care for moms and kids. And it's not a fluke, it's every year. Top 5 health plan according to U.S. News and World Report, year after year after year. Tremendous outcomes in terms of vaccination rates.
To me, everything around us has changed. What really has stayed the same is that commitment to the mission.
For me, the mission comes to life when I see members, when I see them insured, because we get to see that. I see when a member doesn't have an insurance, and then later on I see them when they have their health insurance plan and they're so happy. They hug me, they tell me, oh my God, now I could get my prescriptions, I'm able to see the doctor. Thank you so much. Thank you for helping me get my insurance. We help them stay healthy.
The secret sauce is really the folks who work at neighborhood. They are driven by purpose. They are driven by the mission.
It's nice to be able to help someone every day.
Neighborhood is always volunteering, for example, in our sites. They'll have back-to-school events. They'll distribute winter coats in the winter for the members. They will come during Health Center Week with breakfast for the staff. It's very, very good relationship, I would say.
The diversity of the organization is not what you typically find in corporate America or corporate Rhode Island. As the plan has grown and expanded and moved and added different product lines, that is one attribute that remains, I think, unique to the plan.
Oh, I got kisses.
You cannot put a price to the people that work in neighborhood. It's to a person. Everyone has a sense of mission, a sense that what they're doing is something bigger than just a job. And that is something that in reality, many corporations, many Fortune 500 companies would love to have. So kudos to all the employees at Neighborhood.
Well, 25 years from now, you'll see Grace retired, for sure, hopefully.
My goodness, who thought we were going to make it to 2019? It's about to be 2020. I would love for us, for Neighborhood to be seen as the innovative health plan nationally.
I think when you look at Neighborhood over the next 25 years, I think you're going to continue to see other plans across the country try to emulate us, and we have to maintain that high level of quality for our members. But bottom line for us is that Rhode Islanders need to have access to great, high-quality care, and our job is to make sure that happens.
To keep evolving, as society keeps changing, we need to grow with it and change with it, so we have as well.
As difficult as things can become in the political landscape, what we're doing, at Neighborhood it's so valuable and it's so important that I'm really not concerned about the political landscape because Neighborhood is going to be here for the duration.
I think that's what makes Neighborhood fantastic, is that yes, we've had great success and we have demonstrated that we can deliver, but we want to do more. There's always more to do for our neighbors, to our friends who need great care.
We were founded to address people's needs.
Today, we remain true to our roots.
Committed to community,
Driven by purpose.
Driven by purpose.
And driven by purpose.
Opening doors and breaking down barriers.
To better health.
To stronger neighborhoods.
For many tomorrows,
We'll do what's needed.
that's Neighborhood.
That's Neighborhood.
that's Neighborhood.